you speak a little bit about how Direct Relief is experiencing COVID-19 as both a very local and a global phenomenon?
Thanks, Esri. Yeah, I think it's a good way to frame it that we've experienced it both as a local and a global phenomenon, and that's really played into how we use GIS as well to be able to think fluidly across scales. So Direct Relief is a global humanitarian organization. Like I mentioned, we began responding in China, where we don't normally work, actually. So part of the role there was for GIS is to begin understanding health systems research. How is the health system laid out? Where are the partners? How does the demography of China impact on what we were understanding about the epidemiology of the virus? And we learned from our experience in China as the virus has moved across many other parts of the world. As you mentioned, it's been in 188 countries. We've actually responded in over 40 of those now. And some of those also are countries which, again, similar to China, we don't normally respond to. I mean, we've responded in tandem with the NHS in the UK, which I never actually thought I would see the day that we would be sending humanitarian aid to the NHS. And similar, had to be able to understand rapidly changing epidemiological patterns, which all have a spatial background throughout Europe, the United States, Africa, Latin America, and put that into a coherent framework. Likewise, to link that with supply chain. So the key problem we were responding to in terms of our practical activity is the distribution of PPE, personal protective equipment for making sure that healthcare workers stay safe in their jobs. We had to understand where supply shortages were happening, why those are happening, and how to be able to connect available supply with the people that were in need of it most. Also to link that into risk analysis to be able to stay ahead of the curve of where you're likely to see cases transform into hospitalizations and deaths. And the risk profile was known in some respects early on in China, but has changed significantly as our knowledge has changed, as the virus has moved around the world and as it's affected countries which have a very different type of population, where now in Africa we're seeing people that are much younger but are immunocompromised in new ways, that have HIV, and that are living in much more austere conditions than where we've seen, say, older populations in northern Italy or New York that were really severely adversely affected. And that, I think, has been the key for us to link all of that spatial data into a framework which communicates to our decision makers, our program team, to the partners that we're working with throughout the world, and then to our donor public, where Direct Relief is entirely privately financed, and we have to make sure that we're telling our donor public about how their contributions make a difference to being able to affect the course of the virus.